Hello and welcome, Dr. Rob Willson. How are you?
I'm very well, sir. Thank you very much for having me.
Great to have you here. Rob is a cognitive behaviour therapist who specialises in obsessive compulsive disorder, body dysmorphic disorder, and also health anxiety. And he's here to answer us a few questions today on the subject of health anxiety. So let's kick straight off. And the first question being, how common is health anxiety, Rob?
I think the answer is a lot more common than people think. Um, it was originally thought a few years ago that perhaps the prevalence was around, excuse me, 1 or 2% of the population. But there's been one or two bigger studies, perhaps, for example, a study in Australia that seems to show that it may be about even 3 or 4% of the population. So it's quite high, quite common.
Mhm. So what is it? What is health anxiety?
So by definition, it's a preoccupation with either the idea that one may be ill or a fear of becoming ill. So it's an excessive worry about having or a fear of having certain kinds of illnesses.
Hmm. Okay, so can health anxiety actually cause physical symptoms?
Yes, very much so. It really, if you think about it, any form of anxiety can cause some level of bodily sensations. Um, so we might, for example, if you're nervous, you might have butterflies in your stomach, or you might notice your heart rate goes up, feeling hot and sweaty, these kinds of things. And so any anxiety disorder in that sense can cause physical sensations. Um, Health anxiety, or sometimes called these days illness anxiety disorder, um, complicates that situation a bit further, um, where people will tend to tune into their bodies very closely. And that might be uh, physical sensations of, say, things like tuning into lumps and bumps in your skin. It might be muscle aches and pains. Um, and of course, so some of those things can be caused by, say, bodily tension in the case of muscles, aches, and pains. But some of these things are just part and parcel of normal everyday life, having a human body that doesn't always run absolutely perfectly.
Hmm.
But the problem with health anxiety is that people will then are really tuning in to those areas of concern. So if you're afraid of cancer, you'll probably be vigilant for lumps and bumps and things, or certain hotnesses or swellings and tendernesses and so on. Um, and so the risk is that if you tune into them, if you go looking for trouble, you'll find it. So if you're looking for signs and symptoms of particular illnesses and you're really vigilant and tuning into your body, there's a risk that you'll find things that seem to confirm those fears.
Hmm. Okay. So what can somebody do? How can it be controlled? Can you recover from health anxiety?
Yeah, I think it's absolutely the case that people can recover, and like so many anxiety problems, the more you know, the better. And in fact, one of the challenges about health anxiety is that people oftentimes don't realise that that's what they've got. Um, so really key is to educate yourself about the condition. Certainly learning to relax, learning how to, uh, as you've got good guidance on No Panic website on how to manage those bodily sensations of anxiety. That's really important. Some people respond well to antidepressant medication, much as you might do for problems like obsessive compulsive disorder. Although there can be a particular challenge in health anxiety that is imagined by the nature of the condition. Some individuals with health anxiety are quite sensitive to side effects and the, um, the sensations that medication can trigger in itself. So many patients prefer to have a psychological treatment, and certainly there's been good evidence that cognitive behaviour therapy is a good treatment for health anxiety. Particularly important to learn to resist too much checking, too much. Particularly these days, there's a buzz term called cyberchondria, which is all about people checking too much on the internet for signs and symptoms of certain diseases. So really cutting back on that, how much illness-related and health-related information you might bombard your brain with, um, and certainly particularly learning to live with a degree of uncertainty about how your body works and whether you might develop a particular illness, rather than necessarily always wanting to be sure and to seek some reassurance. Learning to live with that little degree of doubt. and particularly cutting back on bodily checking is really important. Things like poking and prodding and tuning into your body, or even tuning into your mind and into your brain for signs of mental illness, which is a common concern. People don't only fear physical illnesses like cancer or motor neuron disease and health anxiety, they'll also fear things like schizophrenia and so on. So really important to learn to externalize that focus of your attention, really get good at switching your mind into the world around you and trying to avoid tuning in too much and being vigilant for those signs and symptoms.
Thank you so much for this excellent advice. Yes, we do have over on our website lots of resources, free resources that people can check out if they'd like to. And of course, there's our helpline as well if you're worried and want to get in touch with us. Thank you very much, Rob, for your advice. And yes, great advice there for everybody. Thanks very much.
Absolute
Bye-bye.
pleasure. Thank you. Bye.